Hello, welcome to Hair Loss, Restore Your Roots and Confidence. Today, you're going to hear an amazing story by a beautiful woman, 32-year-old Bailey Veach, who was diagnosed with breast cancer in November 2022. After finding a lump on her breast in April 2022, Bailey started her journey of chemotherapy, radiation therapy, as well as targeted therapy, and yes, a double mastectomy. And her progressive journey regarding her hair regrowth during all of these treatments brought her to HPIHair Partners. And she has been kind enough to offer her story for you and us to learn from. So stay with us. Don't leave. Set your dial and be ready for an amazing journey. Listen to us for 30 minutes and you'll hear it all. Hello, welcome to Hair Loss, Restore Your Roots and Confidence. Today we have a special guest, Bailey Veach. Bailey's joining us to share her hair loss story, but more importantly, for those of you who are listening and watching that have been diagnosed with breast cancer or any form of cancer and know that what is taking place with the chemotherapy or the radiation therapy treatments can certainly cause additional hair loss. And so Bailey is brave, and she decided that she wanted to share her story and a little bit about what she's been doing to help get her to the next level of recovery. And so without further ado, Bailey, thank you so much for being here. And we're excited to hear all about your recovery. And right before the show, you told me that you've decided to celebrate in Ireland this year. So we're so excited for you, and we're just glad that you're here. So thanks for your time.
Thank you. Thank you for having me.
You're welcome. So tell us a little bit about your journey with breast cancer. When were you first diagnosed?
I was diagnosed with breast cancer in November of 2022, and it's now 2024, and I'm just now starting to finish up all my treatments.
So that leads me to believe, with enough knowledge to be dangerous, that was a very long treatment cycle. So what was your diagnosis, and why was your treatment cycle so intense and so long?
So I was diagnosed with HER2 positive breast cancer, which requires you to be on infusions for a full year. So I did 6 cycles of chemotherapy every 3 weeks. And with that chemotherapy, I did targeted medication. And then once my chemotherapy ended and I continued on with surgeries and radiation, I still had to do every 3 weeks targeted therapy. So that targeted therapy has just now finished.
Understood. And so then with this targeted therapy, is this a little bit different than chemotherapy or any type of immunotherapy that we're hearing so much about lately?
Yes, it is different. It's not an immunosuppressant drug, so my immune system was able to bounce back a little bit. I could kind of go back to my normal routine. Um, it wasn't something that caused me to be super tired or have a lot of bad side effects like chemo does. I could pretty much go back to my normal life. I just had very mild side effects. But it was very important that I did have this medication so that the cancer didn't come back.
Sure. Of course. Well, and so obviously you're on our hair loss podcast. So now let's talk about the side effect to the medication that you were treated with. So diagnosis in November 2022. Then at that point, how quickly was your treatment started? And then did you also incur surgery during that time? Because we know with treatment cycles, right, with chemotherapy, we can ebb and flow slightly. And then if we have to move through treatment and then long enough to reduce tumor size, then surgery is taking place. All of this plays havoc on our world, but more importantly on our body, because our cells are depleted and all healthy cells are gone. And so that's what our hair feeds from, and it's a lifeline. So tell us a little bit about how that happened.
It was a whirlwind for sure. So I was diagnosed on November 1st, actually, of 2022. And then I pretty immediately went into a fertility drug cycle. So I did 2 weeks of that and then had my eggs harvested. And then the beginning of December, so it's about a month in between diagnosis and getting started, I got my first dose of chemotherapy. And then I think in March is when I ended chemotherapy. They went in a few weeks later and I did have surgery. I had a double mastectomy and they went in and found that I had no residual cancer at that time. So that was the best news I could have possibly gotten. But that meant that I didn't have to continue on with low dose chemo. If there was residual cancer, I would have had to do low dose chemo instead of this targeted therapy afterwards. So I was able to do targeted therapy and continue on that while I did radiation. I started radiation in the summer of 2023, and I had to do 25 rounds of that. It was 5 days a week. And then after that, I got really close to the end of my targeted therapy, and I had an infection in my port. And I had to be hospitalized for 12 days, which was pretty scary. And it was, a long process trying to find out the right antibiotics for me to be on. I had to have my port removed. And then I had to get a PICC line put in so that I could do IV antibiotics at home. And I was on those for 6 weeks. And then the drugs caused me to have a drop in my white blood cells so low that I got neutropenic and had neutropenic fever. So then I was back in the hospital again. They switched up my medication. After a few days, I was able to leave the hospital. And then I got to have my reconstruction surgery. So I had that in December of 2023 and then wrapped up everything in January of 2024. So it has been nonstop craziness for the past a little over a year.
Well, and what I was so shocked to learn when we were seeing you, for continued treatment for your hair loss is that everything was moving along so well, right? And it was, like you said, it was clockwork: chemotherapy, surgery, radiation, targeted therapy, right? And then you think you're out of the weeds and you think, okay, wow, I just have to recover. I just have to heal. And then these crazy infections start coming back at you. And so that's what's so challenging. And you have kept such an amazing attitude and so much positivity through all of this, and I know you have a good support network. So that's so great. But during this time, certainly we were helping you with some of your hair loss and your hair regrowth treatments. And we'll talk about this a little bit later in the episode. But, when we go through those phases of illness, that really also slows our hair growth back down again. So just as we were getting things ramped up, then everything plateaus and then your poor body has to recover, right, from all of these infections. So it's so crazy. But when did you find HPIHair Partners, and when and why did you start seeking treatment for us? Because, right, you were told that your chemotherapy would cause hair loss. You knew that. And from there, then you had to make determinations of how are you going to kind of face that hair loss struggle and how are you going to face that hair loss challenge, right?
Yeah, so my mom actually has alopecia and she has alopecia universalis. So she has no hair over her entire body. And this started when I was in elementary school. So I remember the process of her losing her hair and she first just had patches and then it went on to, having a full head of no hair. So that was pretty traumatic for me as a kid watching my mom go through that. And so I guess the good part about that was that when it came time for me to have to lose my hair, I had someone who kind of had gone through the process and knew about wigs and how to treat wigs and how to care for them and that kind of thing. So that was actually kind of a good bonding experience for us at that point. But I did know that the medication that I was on, one of the chemotherapies, had like a 10% chance of permanent hair loss. And then with my mom's history of alopecia, I started, getting really worried that maybe my hair's not going to come back. So I knew that my mom had gone to HPI a long, long, long time ago. She's kind of given up on any treatments at this point. She's just like, I'm over it. And she's kind of embraced her situation. But I started Googling and I found HPI and I recognized the name. And so I reached out to you guys to see if there's anything that I could do to kind of stimulate my hair regrowth process. So I reached out to you right after I ended chemo, I think is when I came to you first.
Right, right. That's right. And, it's so funny over the years of my, hair restoration, hair replacement, trichology expertise, we find that mothers and daughters many times will bond over, hair. And for reasons that sometimes they didn't realize. And so a perfect example is for what you're sharing with you and your mom, right? Is that, wow, you never thought the negativity of what your mother had gone through would impact your life in such a way. The other thing is with her knowledge and skill set, it gave you a reason to lean in to her love and support. And that's something that it's so organic, right? That those things just don't happen unless you end up in, kind of situations to where you were that you're finding that the only person that really you can find solace from and find comfort is someone that's been through your same situation. And who better than your mother to be able to help with that? So what a blessing for you both. Cause I'm sure, you've had lots of tears and lots of cheers over all of that. Um, so when you reached out to HPI and we started your consultation in and around talking about what was going to happen on regrowth and stimulation, tell me and to tell the listener really, and psychologically, what were your thoughts behind that? I mean, you knew that, well, in your situation, not so much. I'm going to back up because yes, one of your drugs has a total hair loss, condition that can affect 10% of the population if you're taking the particular drug. And so, and I don't like to name names on drugs because everyone's percentage is a little bit different. And so that is for our amazing oncologists and surgeons and professionals in the cancer world. But I think the key is for you, all you could imagine then is walking around looking like your mom. And we love our mothers, but we also try hard at times to be our own person. And we don't want, right? Some of the things that we've had to see them struggle with, and that's been such a challenge in their world. So, with that being said, your psychological driver behind trying to get your hair to grow back sooner than later. Tell us about that. What were you thinking through that process?
Yeah, I had already been through a lot. I had been through finding out that I had cancer with no family history at 32 years old and thinking, what is my future going to look like at this point? How am I going to navigate work? How am I going to navigate being in a bathing suit or, all these things? And the last thing I wanted to have to worry about was my hair. And so I just thought, if there's anything that I can do to kind of jumpstart this process and make sure that my hair does come back and help me to feel better about myself, then I just want to try it. And I was willing to, do whatever it took. It within reasonable limits, to get that process going.
Right. Well, and during that, you were also wearing a prosthetic device. You were wearing a wig. And so that gave you an opportunity to perform the treatments, right? When you were uncovered at home and in the privacy of your bathroom or your shower, or coming into HPI to have the treatments performed as well. So share with the listener what your hair restoration and your hair stimulation treatment cycle looked like.
I first started out with a scalp massage and lots of steam and oils and things that were put on my hair to just kind of cleanse the scalp and stimulate that regrowth process. And I met with you and you gave me some vitamins to take to help my body start getting in a good position to grow hair again. And I started the laser cap, and I did that initially 3 times a week. And then my schedule was trying to get work and and treatments and hair treatments and everything fit in. It kind of dwindled down to maybe 2 times a week. But that's mainly what I did. And then I ended up doing the epigenetic testing and seeing what kind of foods and things that I could incorporate into my diet or not incorporate into my diet to help the process.
Perfect. So we're going to call it really kind of 3 steps, right? So the first is for us to detoxify the scalp, right? So I go back to this with so many clients and help all of us understand is that, when we go in for skincare, the first thing that we find our esthetician or our facialist performs is a exfoliation, right? And so they remove all the dead skin off of our face and our skin. What happens though, when our scalp is not exfoliated and when you don't have hair on your head, you don't understand or know that there's a reason that you shampoo or cleanse your scalp, right? You just think it's just there. And because there's no hair growing, it can just take a back seat because the hair's not there. And in essence, it's just the reverse. It's so important to treat your scalp just as you would the skin on your face when your scalp is void of hair. We need to exfoliate that skin, right? We need to remove those dead skin cells, the oil, the debris that's built up. And what we forget is that our body and our face and the skin on the top of our head, it's a cellular structure. And so our body shifts through and turns over cells every single minute of every day. And if we're not exfoliating those in some sort of a way, then we find that we have clogging or we have debris that's laying on our skin. One, it drags our faces down, right? And we're always looking at ourselves. So we're like, oh, I must need a facial. I must need something, right? To re-stimulate my face. Well, it's no different for the scalp. So that is the reason that we start with the deep penetrating scalp massages or we add in a detoxifying oil treatment. And so we performed both with you numerous times. And as we did that, it started to prepare your scalp for the regrowth cycle for the hair. We have to remember that any form of medication that is taken orally or intravenously, such as chemotherapy, and is going to stay in the system for some time, right? But as the cells start to rebound and as the body starts to regrow, the hair starts to recycle inside that papilla and in the bulb. And so we need to start speeding that growth up. And we do that by that physical massage, that stimulation. We are able to see that blood flow pick up and the oxygen flow pick up when we use different oils to trigger those senses in our body. So that's perfect. And those, I think, really kind of also allowed you an opportunity to feel like you were kind of getting a treat for your scalp and for your hair. You had beautiful long blonde hair before a lot of this took place. So you were used to hair being very much, your identity. And when you aren't allowed to have that identity self-worth anymore and to treat yourself and to feel beautiful and pretty because you have long blonde flowing hair, it's tough for us, right? Even if you have short brown hair, right? It doesn't matter. It's us. It's our real self. And we want to make sure that we take care of our real self, especially when we're undergoing chemotherapy treatment. So then step two, you said vitamins and supplements. We started those with that epigenetic test, right? So we looked at what's going on with your diet. What foods can you be eating? What foods maybe should you restrict that you never even realize? Because now what had happened is that your body was healing, but all the factors in our world, that is what our epigenetics really looks at, is everything above that blood level, right? What's going on in our circulatory system? What's going on in our gut? What's going on in our intestines, in our skin? And so by taking a look at those epigenetics and getting some analysis on what foods you could restrict and then which foods or which supplements you should add in, then that is one of our core beliefs, that we feel that treating the whole body from inside out with the hair, that it's going to make a difference in how quickly your hair starts to grow back. So I really appreciate you bringing that up. That's huge. The thing I would ask, and I mean, like I've told you before, this is free flowing communication. And I don't even know if we've had this discussion, but when you started taking the supplements and changing your diet, did you notice that some of your fatigue subsided, or that you started to feel more balance, or that you had more energy? Or help the listener kind of understand, once, 15 days, 20 days, 30 days with that epigenetic review and with the change in diet and adding in some supplementation, vitamins and minerals, how'd you feel?
I did feel a little bit better. I started to notice that I wasn't quite as bloated anymore. There were things on the list from epigenetic testing that they had listed that were not so good for me to eat, and I was eating some of those things every single day. So, um, that was something that was kind of eye-opening for me, and I felt like my skin even got a little bit more clear.
Good,
So it was, definitely beneficial in many ways.
good, good, good. And then lastly, we talked about you were utilizing the low level laser phototherapy, which penetrates well into the depths of the root of the hair. The other thing that you were also working with at home, Bailey, is you were shampooing your scalp on a regular basis. And you were actually giving yourself that deep tissue scalp massage every day so that you could truly get that stimulation going and get it moving, the blood flow, moving the oxygen. And so what we found is that you rebound so quickly. And we started seeing that new growth coming rapidly, which was wonderful, which then gave you an opportunity to do what on the next step with your extensions. Cause I have to give your extension friend, a shout out, because I know how excited you were when you came in to our clinic to tell me that you were going to have your extensions done. And I know with the smile on your face today that he made you a happy person and a happy camper. So we're going to give him a shout out, and I want you to share information about his clinic and his salon as well.
Yeah. So I started researching, is there anything that I can do to get extensions? Because I just wanted to be back to normal and kind of put this chapter behind me. And so once my hair got long enough, thanks to you guys, I reached out to a salon in Huntsville, Alabama. It's called Terame. And they actually got started in Chemo Girl extensions because they had a client that lost all of her hair due to chemotherapy, and she did have the permanent hair loss. And so she was going to see someone in the northern part of the United States named John Richards, and he is the one that kind of invented this system. called Chemo Girl Extensions. And she wanted someone closer to home to be able to do this extension process for her because she was going from Alabama, flying up there, staying in a hotel. And so this salon in Alabama was able to get trained in this process. And I saw Jessica and Amanda there, and they've done my hair twice now. It's a very long process. I was there for 8 hours each time, getting my my hair done meticulously, putting each strand in one by one. But it's definitely changed my confidence and made me feel more normal again.
And so when you had the extensions done, they take great care. I know you shared with me on the application, but application is one thing. It's the removal that's key to not damaging the existing growing hair and causing any traction to the hair. And so, there's lots of organizations that talk about scarring and non-scarring alopecia. And the problem for someone that is going from hair follicles that have stopped functioning, right? To now starting to regrow. We want to make sure that we're caring for those and we want to get them back to their natural state. And many extensions, I'm not going to use all as a term, but many extensions cause a lot of drag and pull and traction on someone's growing hair. And so that's one of the reasons that I wanted to point this out, because your hair is thick and dense, and it's certainly growing back in the same way that it was before, which is amazing and such a blessing. However, for those individuals who have very thin, fine hair that find, that they, as much as you, are looking for normalcy. And I just want to look pretty again. I just want to look myself again. And so the caution behind that is just critical on making sure that you're utilizing someone such as, your resource. And tell us again the name of the salon in Huntsville.
It's called Terame, and they have 3 locations, but the one that I went to is in their Midtown location.
Okay, great. Great. Well, and like I said, this was kind of on the promptu, but I definitely want to allow our listeners to get their information. And after the show, let's connect. And if you'll just send me over their information, then I'll be able to post it with the podcast and let them know that their phone might start ringing. And I wanted to give them a heads up. So it's good. Well, and so at this point, summarizing our show today, when you look back at your journey of really, oh my gosh, a year and a half, little over, right? Or right around, because you started in 2022 with your diagnosis. However, you found your cyst many months prior to that. And so the worry and the concern that you've been experiencing has really now, we're a couple months only away from 2 years. Do you feel that you can now have a sense of calm and peace at where you are, or does this concern of this reoccurrence of this breast cancer linger with you?
I don't think I will ever be able to not worry about it coming back. I am generally an anxious person as it is, but when you have cancer and there's always a chance of it coming back, it is something that's always going to be in the back of my mind, and I'm trying to do everything I can still to this day to be healthy and keep it from coming back.
Right, right. Well, and you are always in our prayers, and you have been such an amazing ray of light to many of those that I know that you've touched all around the globe, and especially locally, because you are located in Nashville, Tennessee. Is that correct? Okay. And the treatment that you have gone through and all of the experience, I know that it has strengthened your mind and has given you a new outlook on life and all of the things, right? And we're just so thankful for your story and for you sharing it with so many others. And Bailey, we're We just want to keep seeing your hair get longer and longer and all the great things that are happening. So please let us know. Keep us posted on how your progress is going. And don't forget to send us some of those pictures from Ireland, okay?
Yes, I will. And thank you guys. You guys have definitely been a light in my life too. It's a pleasure coming in weekly to see you guys to get my laser cap. And I appreciate everything.
Well, you're a blessing as well, my dear. Thank you so much. And we will talk to you soon.
Thank you.
Bye-bye. I know that you have been inspired, enlightened, and this show has given you an opportunity for hope in many ways. For you personally, for those in your life, for those of your loved ones, your family members. So whatever we can do as HPIHair Partners, as your service partner and service provider, all you have to do is reach out. We're happy to chat with you during the consultation. Also, the items and the products that were discussed in the show itself, such as the scalp treatments, the detox scalp treatments, as well as the photo laser light therapy, are all on our website. You can find those listed under the shop, under scalp treatments, also under laser light therapy, as well as the service. So talking about that epigenetic testing and the importance of really understanding what's going on around our world and that's affecting our body as we heal or just as we go through our day-to-day lives. So the epigenetic test is there as well. Any of our services can be provided anywhere as long as we can see you and as long as we can talk to you and hear your amazing voice and help you in any way that we can. So make it a great hair day. As you know, that's my motto, and we can't wait to see you again on our next episode. Take care. Bye-bye.